Hello, and welcome to the McKnights Product Theater. I'm Kim Bonvisuto, Content Editor of McKnights Senior Living, welcoming you on behalf of McKnights Senior Living, McKnights Long-Term Care News, and McKnights Home Care. Today, we will hear from Kristen Alexander, Chief Marketing Officer of R0, about how communities are using R0's affordable, automatic, and continuous indoor health and disinfection solutions to provide healthy spaces, reduce the risk of infection for residents and staff, and reduce staff workload. We'll have a Q&A session after the presentation, but for now, I'll hand it off to Kristen.
Thanks so much, Kim. Again, I'm Kristen Alexander, Chief Marketing Officer of R0, and I'm delighted to take you through how we're helping support senior care communities in providing healthy indoor environments. When we talk to our customers and also to other facilities in the market, we hear a few things consistently. And I thought to get started, I would share these things with you. These are challenges that facilities are trying to overcome. First, we hear we're short-staffed, especially in nursing and janitorial and in our custodial teams. And because of this, we can't afford the staff we have getting sick. We also hear a lot about HAIs, or facility-acquired infections, and that these are tough on the budget, and tracking sources of infection in order to reduce the infection presence is hard. We also hear that when we have an outbreak, which is inevitable, infection travels through facilities, it's important to contain it fast, and it's hard to prevent it from spreading. We also hear that the cost of heating and cooling our buildings has ballooned, but we don't have a smart way to address it. And that's something we're going to talk about a little later. And finally, we hear from a lot of facilities that they believe in UVC, as it's been proven in hospitals for decades and decades, but it's just too expensive to adopt widely or in my facility. So I feel like it's out of reach. R0 helps senior care facilities across the country solve these problems by providing a real-time indoor health and disinfection platform. This platform does a few things. It understands the health of your indoor spaces, scores risk based on the type of space and how it's being used. It provides autonomous and continuous disinfection for your highest risk spaces and all spaces, such as shared bathrooms and dining rooms, which decreases risk, prevents outbreaks, and improves efficiency. And it saves you money, not only through improved efficiency, which obviously is a major cost savings, but also through saving on energy, which also helps you meet your sustainability goals. Let's talk about why senior care facilities are focused on improving indoor health right now. The world learned a lot from the pandemic and responded with evidence-based recommendations. A few that are important to note, as they will dictate how to manage your indoor spaces moving forward, are listed here. This July, ASHRAE, which is the governing body for setting building standards, released a standard 241, which is for the control of infectious aerosols. This standard calls for target equivalent air changes per hour by industry, for example, healthcare being an industry, and also by room type. Basically, we're going to walk through a chart in just a few slides that shows you in the highest risk spaces, which are those that are most densely populated, there is a very high target for equivalent air changes per hour. The CDC guideline is also of note, recommending a baseline of 5 equivalent air changes per hour across all indoor environments. This is much higher than the air changes per hour we experience in the common indoor space today. Lancet, a well-known healthcare organization, also recommends 6 equivalent air changes per hour, which is a similar baseline to CDC. And we see cities, states, and countries creating relevant guidelines as well, especially around sustainability goals. For example, New York City has pledged to dramatically reduce carbon emissions from buildings by 2050. For reference, in terms of the indoor environments we experience today, most buildings offer half an air change per hour to 1.5 equivalent air changes per hour on average. Healthcare environments obviously are more, but still do not yet reach what would be the CDC or ASHRAE guidelines, depending on the space type, which we're going to cover. Different spaces, of course, have different risks. In senior living, high-risk spaces in this environment tend to be those where many residents and staff congregate, as well as physical therapy and fitness rooms where patients might be breathing heavier or surrounded by other people, so there's a higher transmission risk. Medium risk spaces have some congregation, and low risk spaces are generally lightly occupied or not frequently occupied, and so disinfection need and equivalent air change hour need is different. Here you can see just how dramatically the recommendations have changed in ASHRAE's work. In the higher risk spaces, recommended air changes per hour have gone up as much as 6 times to levels of air changes that are not achievable with HVAC alone. For example, you'll see the jump from exam room from 6 to 8, from a patient room from 4 to 24 equivalent air changes per hour, which hits that 6 times increase, or a waiting room from 12 to 40 equivalent air changes per hour. And this is something that HVAC just simply cannot achieve on its own. So organizations are looking for how they'll hit these goals using technologies in combination. Here's a list of space types in a typical senior care facility. This is just an average. It's important, of course, to take actual usage into account for your own facility. But just to show, large dining rooms, medium or small dining rooms, any dining space, an activity room, a physical therapy room, a fitness room, shared bathrooms would be high-risk spaces. Areas like a nursing station would at least be a medium risk space, depending on how your staff congregates around that area, as an example. And this is why we're offering continuous indoor health and disinfection monitoring to help you determine for your facility where your risk lives. So let's talk about our monitoring and disinfection and how this plays out for you. Continuous risk monitoring uses sensors in all your spaces to identify daily which spaces have heavy use and which don't have very much use. And this helps your teams prioritize the spaces to clean more methodically and frequently, and deprioritize spaces that don't have as much use. For the highest risk spaces, staff can use UVC to disinfect air and surfaces mobily, or deploy an installed solution for continuous and autonomous disinfection, which helps ensure, especially for your highest risk spaces, that they are consistently disinfected, which dramatically decreases your infection risk. In our platform, and as you're considering UVC technology and UVC products, it's important to point the technology to the best fit use case. Here I'm showing ARC, our mobile disinfection tower, which is perfect for a custodial routine as you're doing room turnovers, and also for outbreak response. What's important about ARC and meaningful to the efficiency of your custodial team, as well as cost savings, is that it operates very effectively. It disinfects 1,000 square feet in 7 minutes or less, with 99.99% efficacy in inactivating common pathogens that plague senior care environments. Bacteria, viruses, fungus, it works in preventing the spread of common pathogens like Candida auris, as an example. And if you consider the time savings, what we hear from our customers is that this makes a material difference in cost overall, efficiency of teams, and also staff satisfaction. Because with UVC, they can reliably disinfect air and surfaces in a very short period of time compared to manual chemical cleaning. Manual chemical cleaning is hard in that it's manual and taxing on teams. Also, it's not great to be exposed to chemicals for staff or patients, and also to dispose of chemicals, which is bad for the environment. So UVC is a very sustainable, cost-effective, and efficient solution for disinfection of any space in your senior care facility. We see it often in the turnover of patient rooms and the nightly or between shift disinfection of your common areas. For large areas which are routinely populated, where people are congregating close together, R0's Beam upper room UV technology is the best solution. What Beam does is it provides an invisible layer of UVC light, which is essentially a radiation zone, above 7 feet in any room, so that as warm air rises, and if it has pathogens in it, it rises up into this zone, the DNA or RNA of the pathogen is inactivated, and as the air cools and cycles back down, that air is disinfected. This is a perfect use case for a dining room or an exam room or a physical therapy or a fitness room, because it's operating continuously and autonomously. So the air in between people who are, living together or sharing that space together is disinfected. And the Beam product and upper room UV as a technology offers the highest level of equivalent air changes per hour. And so it's really great in those high-risk spaces where people are congregating together. It can disinfect very large spaces, 500 to 6,000 square feet, and provide up to 12 equivalent air changes per hour, which in combination with HVAC gets to the level of standard that ASHRAE is recommending. So this is great for those large multi-purpose rooms, dining rooms, fitness rooms, where you have people most closely together, interacting with each other. Another installed product is Vive, which provides always on surface and air disinfection for your highest risk spaces and typically smaller spaces. So this might be, for example, shared bathrooms between resident rooms, could be shared bathrooms with the public. This also, depending on the size of room, could be a great use case for a physical therapy room, and also over a nurse's station as an example. This technology is far UV, which operates at a wavelength that is human safe. So humans can be exposed, skin and eyes can be exposed. It operates continuously and autonomously, disinfecting both air and surfaces. It's very light and mounts to the ceiling, and you can establish a routine for Vives. So it can disinfect while people are in a bathroom. It can disinfect overnight so that when you start, when people are more likely to move around during the daytime, the pathogen load in any given space has been decreased or taken down to zero. And so this is a really great use case for those shared spaces that we talked about. For a senior care environment, what you're able to see then is where you have risk and where spaces have been disinfected or haven't been disinfected on essentially a floor plan or heat map. And that can help you understand where risk lives and also set your disinfection routines or determine where you want installed UV for continuous and autonomous disinfection. And so those are the true benefits for senior care facilities that help you reduce costs and provide best-in-class care. Best-in-class care, of course, translates into patient satisfaction, community satisfaction, and your overall scores. One example we wanted to point out is Trilogy, which is one of our customers. Trilogy Health Services cares deeply about resident safety and setting a standard of cleanliness in senior care. They serve 11,000 residents across 127 skilled nursing, assisted living, memory care, and independent living campuses across 4 states, also with physical therapy and pharmacy subsidiaries. They have over 100 ARCs to support disinfection routines and also have installed beams and vives in their facilities to provide that level of continuous and autonomous disinfection in their shared spaces where their communities come together so they can come together safely. Trilogy has been a customer, a long-term customer of R0, and they share that they believe that R0 is part of their commitment to their community, to their residents, to their staff, and to their community at large to really set the standard in safety and what healthy buildings offer, and are benefiting from the cost efficiencies, of course, from deploying R0. Let's talk about cost efficiencies for a minute and how you can think about ROI for your senior care facilities. Continuous disinfection of the spaces in each of your facilities can significantly reduce the burden on your custodial staff, including wiping down surfaces, changing air filters, if you have HEPA filters or other filters, or even if you have portable room filters that require filter changes and maintenance, and can also reduce the cost of chemicals and, as I mentioned, the maintenance and cost of those filters. We've estimated that this can work out to a savings of about 10% of these costs, which are roughly $65 per square foot per year, which means that for your highest risk spaces alone, the savings are around $50,000 per year against an investment of about $20,000, which creates an over 200% return on investment in just the first year and higher in subsequent years. And I'm going to talk through on the next slide what a $20,000 investment might look like. The math works similarly for medium and low risk spaces. And so covering the whole facility with UVC disinfection can generate an ROI of about 200% within the first year, which makes incorporating UVC disinfection into part of your general disinfection protocol a home run investment. We often hear, as I mentioned earlier, that facilities are worried they cannot afford UVC, but that's no longer the case. It's true that legacy healthcare providers of UVC sell products that are very expensive, that cost, from $125,000 to $150,000 in some cases. But this cost level is not necessary based on the cost of manufacturing simple components. And we've cost engineered our products to make them accessible to as many organizations as possible, including senior care facilities, hospitals that are covering more of their space with more affordable products and installed products, schools, our cities and city services, and every environment where we work, live, and play, because the standards have now been established and we are going to be transforming our indoor environments so they are healthy environments for us to occupy. So here are a few scenarios to consider where you can get started for just a $20,000 investment. One option is to focus on maximizing custodial savings, which means you're starting with a fully installed approach, using Beam for your largest spaces and Vive for your highest risk spaces that require both surface and air disinfection. So for that rough spend level, you could take Beam into all of your large spaces, your dining room, your fitness room, physical therapy, if you have a multi-purpose room that you use, for events or recreation in that room as well. Beam can be installed 1 per room or 2 per room if you have a very large 5,000 or 6,000 square foot room, and Vive in your busiest bathrooms and potentially nursing station as well. A second option that maximizes is to maximize savings and provide outbreak control. And in this example, you would have 2 beams for your 2 largest spaces, 2 Vives for your highest risk bathrooms or exam room or physical therapy room, and then 1 arc which you could use facility wide for room turnover in your daily disinfection routine, which saves your team not only time but also provides higher efficacy than the disinfection routine that you would have in place today. And a third option is focused on that custodial efficiency with 2 arcs and also pointed towards outbreak control, so that if you have an infection or a pathogen that is spreading through your facility, you can contain that by focusing on more frequent disinfection in the areas around where that infection lives. Each of these options, just for demonstration purposes, is just $20,000, letting you know the reason why we're sharing this is to let you know that it is affordable for you to get started and will save you money over the cost, or over the duration of your first year in efficiency and cost to you. R0's mission is to provide healthy indoor environments where we work, live, and play across industry. We wanted to show you a sampling of the customers that trust us in healthcare, such as Stanford Medicine, Carle Health, and we are also with Mayo Clinic. And then in education, across some of the largest schools in the country, we have a top 5 school district in the country and large schools. We also work with smaller schools, and particularly have been working more recently in new builds as well. So, as we're transforming our nation's schools, it's really exciting to be starting at the beginning. We work with, government, association services, city services, the public sector at large, many sports teams and well-known companies that are interested in providing healthy indoor environments for their employees. And of course, we have strong strategic partnerships, as I mentioned, with the Mayo Clinic, with SC Johnson, and with some other partners. And if you have a partner you like to work with and you wanted to work with us through your partner, that's something that we're open to doing as well. Again, our mission is to bring the best-in-class disinfection platform and understanding of indoor health and risk platform to every senior care facility in the nation. And we are delighted to partner with you in any way that can help provide this level of environment and care for your community and ultimately help you be successful. Thank you so much for spending a few minutes to hear about the potential and opportunities you have to provide the healthiest environments for your community. And I think I'm going to turn it back now to Kim, who may have a few questions from the community.
Great. Thanks for that informative demonstration, Kristen. We do have some questions from our audience, so let's get to it. Our first question, you mentioned different products make sense in different space types. Could you give some examples?
Sure. So, for example, in a senior care facility, if you have a large dining room where you're managing multiple shifts of, lunch, breakfast, lunch, and dinner, Beam is a great use case for that, which is upper room UVC. It's also called germicidal UV, where the air is cycling in that room using UVC technology at a higher rate. So Beam can provide up to 12 equivalent air changes per hour, which means that as folks are breathing out, their air is rising into the radiance zone at the top of the room, which is an invisible layer of light. Pathogens are being inactivated there, and as the air cools and comes back down, that air is disinfected. So we recommend that technology, and also that is supported by science. There are many studies that show that UVGI is highly effective and also provides the highest level of air changes per hour. You can do research and look up some webinars shared by Dr. Nardell at Harvard University about the benefits that this technology has provided in hospitals for decades and decades, particularly fighting the spread of tuberculosis.
Okay. With the tight margins in nursing homes, how can they afford this?
Yes. So as I showed in the slides, there is, you can get started at a very reasonable cost level. Also, many states are offering infection prevention or infection control grants, and we've helped hundreds of senior care facilities apply for and win these grants. So if in your state you know of an infection control grant or a senior care facility grant, sometimes they're labeled as building grants. So, as you're transforming your building and investing in technology, UVC will often qualify for that funding. If you have a grant you would like to pursue, we will help you apply for and win that grant, as we've done with, as I mentioned, hundreds of facilities in states like Michigan and Tennessee. And also something important to mention is that there is an investment, obviously, in the new technology, but with the custodial savings that you experience, they pay for themselves within a few months, within the first year. So that's a real benefit to getting at least started. And then as you progress, if you want to cover facility-wide, you can do that. And it also helps you save on energy, which is, really great for the bottom line as well.
Okay. And our final question is, if this is such a slam dunk, why isn't it more common, especially after so many senior care facilities struggled with the pandemic?
Yes. So as I mentioned, UVC disinfection is not a new technology. It's been proven in hospitals for decades and decades. It won the Nobel Prize in medicine in the early 1900s, in 1903, in fact. So it's been around for a long time and most frequent in hospitals. However, there are a few things that have prevented the widespread adoption in senior care facilities. First, it's just been extremely expensive. Spending $125,000 to $150,000 on one mobile disinfection tower is cost prohibitive. So for that reason, it hasn't spread as quickly in senior care as it has in an acute care hospital setting. Second, it hasn't been offered in all of the form factors that would be appropriate for this environment. For example, installed products. So there have been, mobile disinfection towers. Our tower is very sleek and easy to navigate, and we hear from our customers they enjoy using our products, but there are other UVC products in the market that are bulky, clunky, and not installed products as well. So that's been a limiting factor, and we're really, focused on providing, best in class products so that customers adopt them and want to use them. And it hasn't been intelligent or smart. And so something that's worth mentioning is all of our products are IoT enabled, which basically means that they collect data on your indoor health and also report that data and your disinfection, so we can tell the UVC dosage in any room, and we report that data into our software platform so that you can gain real-time insights that help you be smarter about disinfection. And that's a real benefit that our customers experience. That is also a differentiator for our approach in the market. You want to know that you're disinfecting the right spaces on the right routine, that you can save costs through doing that, and also have an automated way to determine where risk lives. And that really helps, that data-driven approach really helps teams be smart and efficient about how you manage indoor health.
Okay. Well, that's all the time for questions we have today. If anyone listening had a question that was not answered in this session, please know that someone from R0 Systems will contact you to provide additional information. You can also visit r0.com for more information. Thanks again, Kristen, and to everyone listening. We hope you found this demonstration helpful. For McKnights, I'm Kim Bonvasuto.